Welcome to our ongoing podcast series, 10 Minutes On, created by the 100 Million Ways Foundation. In this series, we'll devote 10 thought-packed minutes to topics of general interest to the 100 Million Ways community, issues including chronic pain, opioid use, and related stress. Today's topic, psychedelics as medicine. And with us to discuss the exciting promise of psychedelic medicines is Tyler Strauss, whom we'll introduce in just a moment. Our topic, psychedelics as medicine, will come in two parts. Today's segment will address the history and promise of these agents. Part two will focus on practical issues surrounding psychedelics. What's the right dose? What's the best setting? How do you gain access to psychedelic agents when laws will vary from region to region and when they're changing very rapidly? Today, 2022, scientific interest in psychedelics as medicine has reemerged. Today, psychedelics are being used to treat a variety of diseases and conditions such as PTSD, depression, addiction, cluster headaches, and many others. Let me now introduce today's guest, Tyler Strauss, who has a deep experience in the area of psychedelics as medicine. Tyler, please tell our audience a little about yourself and your experience in the area of psychedelics as medicine.
Hi, my name is Tyler Strauss. I am an entrepreneur in the cannabis and psychedelic space. I am a consultant with 100 Million Ways, and I am also a VP of product development for EI Ventures. EI Ventures is focusing on the development of novel delivery systems for psychedelics, as well as for supportive tools to help people who are using psychedelics to achieve the transformational benefits that they desire. My interests are in helping people reduce their suffering and improving their quality of life. I'm very grateful to be a part of 100 Million Ways and to be supporting them in their journey to help people overcome opioid addiction and other mental health disorders.
Thank you, Tyler. The potential of psychedelics as medicine, as therapy, has long been recognized, and yet widespread integration into clinical use has been slow and halting. Tyler, what accounts for this sudden revival of interest in psychedelics as medicine?
You know, that's a complicated question because psychedelics have been a part of humanity's history for thousands of years. In the 50s, they were used in psychotherapy. They were a part of the psychiatric paradigm of the time. Because they were also adopted by the counterculture, they inevitably became criminalized, unfortunately. And, you know, that led to a sort of a modern dark ages where psychedelics were not accessible to patients, clinicians, or researchers. It wasn't until relatively recently that the data began to show that psychedelics, specifically psilocybin and MDMA, were particularly useful for chronic, poorly managed mental health conditions such as major depression and PTSD. They've also been shown to be potentially beneficial for a wider range of mental health and as well as other health conditions. And as a result, interest in psychedelics has really exploded over the last few years.
Tyler, tell us a little about the latest scientific research in this area. Where are we getting our best new information?
One of the organizations that has been sort of instrumental in moving us towards a place where psychedelics are accepted as medicine is MAPS, the Multidisciplinary Association for Psychedelic Studies, which was founded by Rick Doblin, I think over 40 years ago. And, you know, in his commitment to psychedelics as medicine has really helped to move the ball forward to a place where today we're able to have conversations like this regarding the real potential for psychedelics to be, you know, a transformational therapy for people who are struggling with various health conditions.
Are we getting a better understanding of how these agents are actually working?
Research done out of the Imperial College of London, Johns Hopkins University, advances in neural imaging, which have been able to show us what is happening in the brain so that we're less reliant on sort of patient-reported outcomes or other psychometrics which rely on patient-reported data. have really enabled us to feel significantly more confident in the potential for psychedelics to be useful as medicine.
What exactly do we mean by the term psychedelic? How do we define psychedelic? And do all these agents work essentially the same way, or are they significantly different in their mode of action?
Psychedelics is a bit of a catch-all that refers to any substance that has an effect on our psyche. What people often think of when they think of psychedelics are what we would generally refer to as the classical serotonergic psychedelics, such as psilocybin, LSD, mescaline, ayahuasca, DMT. There are other psychedelics which are not, strictly speaking, classical psychedelics, such as MDMA, which has a similar effect, but it works in a slightly different way. So classical psychedelics are what we refer to as serotonergic psychedelics, meaning that they mimic the behavior of serotonin in the brain. MDMA, which is also considered to be psychedelic, is a serotogenic psychedelic, meaning that it provokes the generation of serotonin in the brain, as opposed to mimicking the effect of serotonin in the brain.
Might we expect that new psychedelics coming down the line might have fewer side effects or be less problematic in their use?
There are other psychedelics which are not classical psychedelics, such as 2CB and other compounds which also affect our psychology, our perception. And in addition, there are also drugs such as ibogaine, which came out of Africa, which has recently been developed into a semi-synthetic analog that has fewer potential side effects. And I think that's where we're heading, is towards a new generation of psychedelics that will be less acute in their hallucinogenic effects, which is one of the symptoms of psychedelics, meaning that it affects our visual acuity and changes the way that we perceive the world visually. But still providing many of the neuroplastic benefits. So it allows our brain to take advantage of the ability to adapt and to remodel itself in order to function better in the world.
One thinks of psychedelics as treating emotional, even spiritual issues, but what's their potential for treating conditions such as chronic pain and stress?
I think that psychedelics for chronic pain relief, particularly neuropathic pain that essentially originates in the central nervous system or as a result of some dysfunction between the central nervous system and the peripheral nervous system, is possibly one of the more exciting areas of research that's ongoing right now.
How are we to know what psychedelic agent to use for any particular condition?
You know, I think that one of the challenges that psychedelics pose to our medical system, they are forcing us to really rethink how we do diagnosis. We have traditionally diagnosed mental health conditions by way of their symptoms, whether it's depression, anxiety, PTSD, obsessive compulsive disorder. We tend to rely on patients reporting how they're feeling in order to determine what condition they have and whether or not a particular intervention is helpful. Increasingly, I think that we will need to move towards more objective measures, whether it's biomarkers, neural imaging, or more sophisticated forms of analysis in order to determine what the underlying conditions are. Because unlike more traditional psychiatric medications, which tend to be top down, whether it's SSRIs or MAOI, which aim to increase the levels of serotonin in the brain by inhibiting their reuptake, serotonergic psychedelics and psychedelics in general seem to work more bottom up. And as a result, they seem to have benefits for a wider range of mental health and health conditions than traditional interventions. And so if we're going to be addressing these conditions in a bottom-up fashion, it really requires us to understand the underlying causes of these conditions. And there are many people who are at risk due to their genetics, due to an inherited feature of their biology that puts them at risk. Those people may or may not ever suffer from a mental health condition, but they are at risk. And that risk means that if they're exposed to a trigger, they're more likely to suffer as a result.
We'll end here. Please stay tuned for part 2, available shortly. In this part, we'll focus on practical issues surrounding psychedelics. What's the right dose? What's the best setting? How do you gain access to psychedelic agents, given that laws will vary widely from region to region? And of course, laws are changing very rapidly. Thanks again, Tyler, and thanks for all of you out there for your interest. We invite you to visit our website and become a member of 100 Million Ways. It's absolutely free and entitles you to a host of free resources. On our website, you can also leave comments about today's broadcast and also leave suggestions as to what topics we might address in the future. You can also enlist in a paid scientific study, the Odyssey Registry, and so much more. Until next time, thank you. This is Don Stewart.